the message is to tell them we waited long enough. It's time to get health care reform done. There are certain things that we're advocating. We're advocating the public option. They would have the public to believe the public option is dead. That is not true. We are going to win on this issue if we be vigilant for just another day, for just another week. Don't give up and don't be weary in well-doing. We're going to win on this issue. And at the end of the day, when we get through and we have a bill on the president's desk, it's going to be guaranteed quality, affordable health care for all. It's going to be affordable because Arkansas is one of the states where the affordability issue and the affordability report that we have today that talks about what the health care reform measure will do for Arkansans. It's important to us because we are one of the poorest states. The 4th Congressional District is one of the poorest districts. It has the largest numbers of minorities.
My name is John Noonan and I'm with the American Federation of State, County, and Municipal Employees, or AFSCME. We're very glad to be here with our partners at the AFL-CIO, HCAN, SEIU, Change That Works. I want to thank you all very much for participating in this day of action that we're having across the country. An entire day dedicated to sending one single message to our elected officials, and that is that healthcare needs to be done now. You know, we're closer than we've ever been to real healthcare reform, and it is time to deliver. It's not a time to step back. It is a time to push forward across this goal line like we haven't been able to for so long. We have 3 main tenets to what we believe should be included in a solution to our healthcare reform. Basically what we're looking for, first and foremost, is a public option in our healthcare solution, one that will compete with private insurance companies and bring down costs for everything, or for everybody, excuse me. Real reform also includes a provision of an employer mandate, so we can build on the system that we have now and get employers included and continue to be playing in the system. One where if they choose not to provide health insurance for their employees, they offer a subsidy, so everybody will be able to get insurance and everybody will be able to get cheaper insurance. And the last part that we are really concerned about is making sure that there's no excise tax on our healthcare plans right now. There's some debate in Congress as to whether or not high-cost plans should be taxed. We think that is definitely the wrong way to go. Where people have been bargaining for these plans for a long time. They've taken these benefits in lieu of pay increases, and we need to make sure that nobody's healthcare benefits are taxed.
As they said, the events going around today, it's write-ins, call-ins about health care. Everybody's always asking organized labor, why is your big fight in this? Most of your members already have health care. That is correct. We know what it's like trying to live out there without health coverage, trying to raise a family and put groceries on the table. In our negotiations, we're negotiating all the time on health care. We're losing the opportunity to negotiate on wages. That hurts the community. They count on our income. So we've got this big fight here. We're also scared. These plans they're talking about taxing, that's our plans. We are the middle class. Unions brought you the middle class. They're the ones that brought you this health coverage to start out with. We're trying to make sure we protect that. We're not taxed on another burden. Right now, someone with a good health insurance plan, they pay $1,500 a year premium to have someone that does not have health coverage. You're putting that money out to cover them. Everyone should have affordable health insurance, and that's what this public option is. It's those that need it. These companies that want to play, they need to pay. They need to make sure they're part of this. I've heard the number as low as 8% is what it might cost them. Hey, they're getting a heck of a bargain for insurance at 8% with public options.
My name is Nicole Price. I'm the State Director for Arkansas Change That Works. Change That Works is actually a new 501c4 organization. It's permanently relocating to one of 12 states, Arkansas being one of 12. I just want to piggyback off of what John and said earlier. As well as Alan. We're the closest we've ever been on health insurance reform. We now have 5 out of 5 bills voted on our committee. We're the closest we've ever been, the closest we ever will be. And so everyone keeps asking that we have to make calls today to make sure that Senator Lincoln, Senator Pryor, and all the members of the Arkansas Congressional Delegation hears our voice. And an electoral campaign is really easy to say on November 4th, this is election day, and that 3 weeks leading up to that day, you're preparing, you're getting ready to get out the vote, you know exactly what your goals, you know exactly what you're working towards. But we don't know exactly what that date will be. But we know that we have to keep the pressure up. We have to make the calls, because this is the closest we've ever been. We may not have this opportunity again. Dr. Martin Luther King once said, of all the injustices that exist in this world, by far the ones in healthcare are by far the most inhumane. We have a chance to right that injustice. We are right there, we're at the cost. But it's gonna take all of us to make a call. And as folks have already said, tap into your social network. To ask them to make a call. Not just today, not just tomorrow, but until this is done. So as Alan said, that we can celebrate Thanksgiving and say that we are thankful for the fact that we've passed health care reform. In just 2 short weeks, we will be celebrating the fact that America voted for change by electing President Barack Obama. What better way to celebrate it than to keep the pressure up right now and help him get past one of the things that he said is his priority, as his agenda.